Hello, guys. Welcome to our lecture series on health system and how, as an entrepreneur, as a medical entrepreneur, you can hack the health system so that you can develop healthcare startups for the health system. So, on this screen, you can see that there is something like a house on the screen. So think of the health system, and let me define the health system first. The health system is basically it's a system. It's a organizational structure that imparts health. It can be a health that is imparted at the level of a hospital. It can be a health that is imparted at the level of a district or at the level of a province or a country. With that in mind, let's start off by looking at what is the health system. So, a health system primarily is composed of six building blocks according to WHO, World Health Organization. And as you can see here, that the base of that system is made by leadership and governance, a strong leadership and a strong governance framework, and we'll discuss that in later on sessions on what do we mean by leadership and governance. But in essence, a strong leadership focus with accountability, with transparency, results in a very strong health system. And then on top of that, the other most important thing is healthcare financing. How is healthcare being financed? Is it being financed through out of pocket payment, or is it being financed through, say, any prepayment mechanism such as social security or private health insurance? The other components that form the health system. So the first building block is leadership and governance. The second is finance. The third is health information system. What information are you gathering from the system? How are you using that information for management, for decision making at the level of the provider, which is could be the doctor, could be the paramedical staff, and then at the level of the managers, at the level of policymakers. The other building block of the health system is the human resource. So, what human resource is part of that health system? How is that human resource divided? How is that human resource? What is the capacity of that human resource? Are they given the right tools to work with? The other thing is supply chain. So, medicines, equipments, and drugs. They form a very strong component of the health system because you might have the best doctors, the best staff, but unless you have medicines, you have other material available such as surgical instruments, radiological instrument, or laboratory instruments, you will be unable to function. And then on the top of it is service delivery. Service delivery is that a patient sitting in front of a doctor or any service provider, be it a nurse or a physiotherapist, or in a lab or in a radiology service, how is that service being given? So there are six building blocks to the health system according to WHO: leadership and governance, healthcare finance, health information, human resource, essential medicines, equipments, and drugs, and then service delivery. With that being in mind, these six building blocks, let us move towards some other things. So today what we're going to do is that we're going to discuss what are the concepts of social determinants of health. We're going to describe what are the goals, what should be the goals of a health system according to WHO, what should be the functions, essential functions that should be provided by the health system. We're going to apply assessment framework for the health system. We're going to look at some assessment frameworks, and then we're going to look at some of the measuring indicators for these six building blocks that we just went through. With that in mind, let's just start off our session. So, being in business is like being in war. So the great Chinese general, his name was Sun Tzu, he said, if you know your enemy and if you know yourself, you need not fear the result of 100 battles. So that is what holds true if you are an entrepreneur. So it's very important for you to understand the system that you're going to go into and change as an entrepreneur. With that in mind, let's look at what is a health system. So, primarily, a health system is any system whose primary purpose is to promote, restore, and then maintain health. So, if someone is very healthy, then there should be a health promotion, a preventive side to health. If someone is unhealthy, then their health should be restored. If someone was unhealthy, is now healthy back again, then how do you rehabilitate them? How do you maintain their health? So those are the key primary purposes of a health system. Like I said, these are the 6 building blocks of the health system: leadership and governance, service delivery, a health information system, health finance, essential medical products and technologies, and human resource. With that in mind, let me just give you another concept. Within health, there is a hierarchy of service delivery. So the hierarchy of service delivery goes like this, that there is something at the base called as the primary care. The primary care is the first level healthcare facilities. They're also called as FLCF, first level care facility. What do? They're basically basic health units. They might be placed in the rural settings. They are small dispensaries. Their primary focus is to treat patients in an OPD setting, outpatient department setting, in a clinic setting. And that's what primary care most of the time does. There is something else attached to it, for example, immunization activities, vaccination activities, maternal child health activities that might be done through frontline healthcare workers, which could be lady health workers, which could be nurses, which could be midwives at the level of the community. Above that is another care level, which is the secondary care. Secondary care hospitals are basically hospitals that have inpatient services. Primary care only has outpatient services. Secondary care hospitals have inpatient services and outpatient services both. They have surgical services available, but they have a narrow focus. The coverage of services is around maternal and child health. So they might have a neonatal ICU, they might have a pediatric ward, they might do surgeries, but the surgeries would focus on basic, essential general surgical care and gynecological care. So that might include cesarean section. They will have a built-in blood bank with them. So there are two terms to this, which is basic emergency obstetric care, and then comprehensive emergency obstetric care. So comprehensive care includes the services such as blood bank, such as surgical and cesarean section services available. On the other hand, basic services include all the services that include delivery, but it has to be a normal delivery. With that, there is a third level of in the hierarchy of health service, which is the tertiary care facilities. The tertiary care facilities are big hospitals which have a lot of sub-departments. They have a surgical ward, a medical ward, and they are also teaching hospitals. So the tertiary care facilities are teaching hospitals primarily. They are mostly located in urban areas, in large population centers. So you might have a large number of primary care facilities, a smaller number of secondary care facilities, and a very small number of tertiary care facilities. That's the hierarchy. That's why you see the pyramid. Moving on with that, there is another thing that you guys need to know if you want to be healthcare entrepreneurs, which are the social determinants of health. So the social determinants of health are basically conditions in which people are born, they grow, they work, they live, and the wider set of forces around their surroundings that shapes them, forces them, that shapes their life. It could be associated with the economic policies of the country that they live in. It could be with the economic system, the political system that they live in. It could be superimposed by the developmental agenda of that country. It could be superimposed by the social norms of that country. It could be changed by the social policies of that country, the political system of that country. and so on. So these social determinants might look like they have nothing to do with health, but they have got a huge impact on health. Because if it's not in the developmental agenda to finance health, then you're not going to see good health coverage and good health outcomes in those countries, as is the case with most of the low and middle income countries. And if you are unable to set up a system, a healthcare system, a health system that imparts health and improves health outcomes, then that would not result in a culture, a healthy culture within that. So, and then you need to have economic policies that support healthy initiatives. An example of that could be you invest in cycling tracks on road, or you invest in walking tracks on road, or you invest in parks, you invest in sports activities, stuff like that. You invest in the nutrition of the population. You pass laws and legislations according to that. So WHO says that there are health inequities, and those health inequities, they have a huge impact on health. So what do you do about it? So with better governance for health and development, that results in health sector orientation towards sustainable developmental goals and with a basic focus on health. And that helps in tackling health inequities through actions focused on key sectors. And then eventually, once you have taken those actions, then you need to monitor the progress of what you have tried to impart here. Now, social development and the social determinants of health are big aspect of what eventually results in the overall health outcome of the country. But it's a huge subject. It could have a session on its own. So we're not going to delve deep into the social determinants of health. There are some proximal determinants and there's some distal determinants of health. Today, the primary purpose of this session is to focus on the health system. Okay. What you're seeing here is basically the 17 Sustainable Development Goals. So United Nations has developed 17 goals that they think is important for the development at a global scale. And in that, the goal number 3 is good health and well-being of the 17. And even though health is the third SDG, and they have given it a target between 2015 to 2030, what goals we need to achieve. And the primary purpose is to get to a point where we are able to give universal health care. What that means is that we are able to give essential health care to everyone along the globe, no matter where they are. But there are other SDGs that directly impact health. For example, poverty has a direct impact on health. Quality of education has a direct impact on health. Gender equality has a direct impact on health. Clean water and sanitation, renewable energy, economic growth, reduced inequalities, sustainable cities, responsible consumption, climate action, peace and justice. And then there is a 17th SDG, which is basically partnering of all these sectors. So in essence, even though the third SDG is health, but there are all the other SDGs, they have a direct impact on health as well. Indirect impact on health as well. Okay. So let's look at the goals of a health system. So according to WHO, a good health system needs to have 3 goals. Number 1, it needs to improve the health of the population. Number 2, it should be responding to the expectation of the population in that area. And number 3, it should give financial protection against the cost of ill health. So if someone gets ill health, and if they are living in a low and middle income country, according to the World Bank criteria, they will end up giving payment out of pocket. So they go to the hospital or the doctor or the clinic, and the doctor says or the hospital says, we'll give you this health care, but there is a cost to it. And then they first pay the cost out of pocket and then they get the health care. But if they are living in a poor country, they will be unable to sustain themselves. They will be unable to pay for that. So therefore, they will delve into their savings and they will cut into their assets and into their savings. If they are delving into their savings, more than 40% of the savings, then that is directly called as something called as catastrophic health cost. And catastrophic health cost has an impact on the overall health of the population, because um, health is very good, but in order to achieve health, if you end up in poverty, that is then a vicious cycle in which poverty then leads to ill health, and then ill health again leads to poverty, and as is the case with so many families in low and middle income countries. So a good health system needs to be efficient, it needs to have good quality, and it needs to do something called as equity based healthcare distribution. So health improvement needs to happen of the population. That's goal number one. Goal number two, the health system needs to be responsive of the people's expectation, of their culture, of their needs. And then there has to be a fairness in the financing mechanism. A fair financing mechanism is to pivot from an out-of-pocket payment system towards a prepayment mechanism. In a prepayment mechanism, you could have a private health insurance mechanism, or you could have a social security in which people pay taxes and those taxes are collected, and through that health is imparted to the population, as is the case with most of the Scandinavian countries. And an example of that, other than the Scandinavian countries, is UK, which has the NHS, the National Health Services. Now let's look at the functions of the health system. The functions of the health system primarily are four. Number one key function is financing. And financing itself is basically made up of three things. Number one is revenue collection. So you collect revenue. Number two, you pool that fund. So we as citizens of a certain population might give taxes. From those taxes, a certain amount of that tax is allocated to health. So there is the revenue collection. And then that fund is pooled into a health fund. And from that fund, the government might give us health insurance backed up by social security. And so through that fund pooling, the government might purchase health services for us. So three key functions of the financing itself, sub-functions of the financing. And financing is the first function, A, of health system, which is revenue collection, fund pooling, and then purchasing. That's number one, financing. Number two is stewardship. How do you lead the health system? So leading the health system is, so what's the leadership structure? What's the agenda? What's the transparency look like? Within the health system, what is the hierarchy of the health system? Within the health system, how is there a feedback mechanism to make the health system more responsive to the needs of the population? So all those things are part of stewardship, leadership, and governance. Then number three, C, is resource generation. So how are the resources generated for the health system itself? So like I said, the most important function is financing. The second function is stewardship. The third is resource allocation, resource generation for the health system. So resources could be generated through, like I said, out-of-pocket payment. It could be generated through a funding mechanism in which a global budget is given by the government, paid for by the taxpayers. Another could be that there is some sort of philanthropy happening. So people are giving money out for a good cause, and then that is being diverted towards health services. Another could be some foreign aid. So there are a lot of donor organizations globally. They might be funding some health services. And then the last function, D, is provision of healthcare. So we are doing all this financing. We are generating all these resources, which could be human resource, which could be material resource. And we have developed a strong leadership governance. But then we also need to impart health. So imparting health for personal care, so personal health services, which could be preventive, which could be curative, and then non-personal health services, which are done at a population level. So that could be not directly giving any health intervention, but that could be associated with improving the quality of the water and sanitation services, which could be health promotion at school health level, So a lot of the public health programs are non-personal health services. Personal health services primarily are services that are driven, customized, and as we move towards the digital health uh, paradigm globally, we will see that there is a rise of personal health services. We need to also understand that the health system globally is integrated. Now, it can be integrated in different ways. There is something called as a vertical integration. There is something called as a horizontal integration. Now, you must understand that vertical integration, and when we say this integration, we are basically talking about the four functions of the health system, as you can see on the y-axis: revenue collection, fund pooling, purchasing, and provision of services, and with a very health finance focus. Now, in that, if we are to say that we are to look at a health financing mechanism for the health system, there has to be vertical and horizontal integration. Now, what do we mean by that? If we have complete vertical and horizontal integration, that means that vertical programs which could be focused on specific diseases such as polio, malaria, hepatitis, they could be associated with maternal child health, they could be associated with improving, say, the quality of dental care, or that could be associated with reducing the occurrence of a specific disease that might be endemic to that country, such as, say, yellow fever. And so that is the vertical part of the health. The horizontal is that you have this hierarchical structure that we just discussed: primary care, secondary care, tertiary care, in which you're dealing with all diseases, and you're dealing with this in a hierarchical fashion. That's the horizontal care. So when you're dealing with all the diseases, you're not focused on one specific disease. That is horizontal health care provision. And then vertical healthcare is focused on a disease. Why did we even have this vertical and horizontal integration to start with? Because way back in the 60s, 70s, and then in the 80s, we wanted to improve the health of low and middle income countries. But we realized that because of the resource crunch, because of the budget crunch, we did not have enough funds to give horizontal healthcare across the board and develop a very strong PHC system, primary healthcare system. So we focused on specific diseases and we applied that. But over the years, we realized that vertical alone doesn't work. It needs to be integrated with the horizontal system. And if you focus too much on the vertical, then you will weaken the horizontal health system. So the best system is where you have a vertical and a horizontal integration, a singular system. Then there are some health systems in which there is vertical integration, but there is horizontal segmentation. What does that mean? Well, the vertical program, for example, the polio program, starts off at the national level, goes to the provincial level, then goes to the district level, and they are unified under a single platform. But it's not integrated with the overall primary healthcare PHC. It's not integrated with the secondary care or the tertiary health system. That's called as a vertical integration, but a horizontal segmentation. There is another system in which you have a vertical segmentation, but there is a horizontal integration. What does that mean? That even though horizontally, all the primary healthcare services, the revenue collection for them, the fund pooling for them, the purchasing and the provision, right? It's being done simultaneously for all of them. And all the stakeholders are on board for the PHC, for the horizontal health system. But the vertical health system is not integrated. That's another issue. Apart from that, we see something called as the vertical and the horizontal segmentation, in which neither the vertical system nor the horizontal system are integrated with one another. So that's just some of the types of integrations that I want to discuss here. So moving forward, if you want to strengthen the health system, so World Bank and WHO, they say you need to build capacity in critical components of the health system. to achieve a more equitable and sustainable improvement of health services and health outcomes. Now, in order to do that, there is something called as a health systems framework that has been developed. It came in 2000. There are multiple health systems framework. The WHO framework came in 2000s, which was the health system framework, and it primarily gave an idea of the 6 building blocks, and from there we are leading it forward. But if you want to strengthen the health system itself, we need to also be able to gauge whether the health system is working or not. For that, we have some frameworks to gauge the performance of the health systems. For example, like I said, we had the WHO framework that came in the year 2000, and it primarily focuses on 4 key functions, which is resource generation, financing, service provision, and stewardship. Then we have the World Bank control norms, which has a very economic perspective to it and says that there are basically 5 control knobs, and if you play with them correctly, you can improve the health system, which is financing, organization at the macro level, payment mechanisms, regulation, and education and persuasion. And it's a very economic focus on the health system itself. Then we had the building blocks framework that came in 2007, and it has a 6 building blocks approach. We had a primary healthcare framework that came in 2008. It had 4 policy areas, which include dealing with inequities, putting people at the center of service delivery, integrating health into public policy, leadership for health governance. And the last was a systems framework that came in 2008, and it's one of the less used ones. But primarily, what we see being used, the control norms is used, the WHO building blocks framework is used in the primary healthcare framework. We'll discuss the primary health framework later on in other sections, and the building blocks we have already covered today. So with that in mind, just to give you a brief insight, so we had already discussed what were the goals of the health system: to improve the health, become responsive, give social protection, and then improve the efficiency of the system. At the same time, the building blocks of health system are the 6 building blocks, which include leadership and governance, financing, access to medicines, health information system, health workforce, and service delivery. There are some monitoring and evaluation tools for the health system, which primarily apply something called as an LFA, which is a logical framework analysis. I'll not go into the detail of that, but just stopping here. If you are a medical entrepreneur and if you know your system, then you can create solutions for that system. If you can create solutions for that system, how can you do that? If you know the problems of that system. So once you know the problems, once you know your system, you can create solutions for that. That's why it's very important to understand how health functions. And then you also need to understand at which level of the health system you need to go in, what should be the scope of the work you will do, which building block you need to focus on, what are the competitors in that building block, and how will you maneuver in that case. So I hope this was helpful, and I'll see you in the next video.